So in the past 2 weeks, several consensus statements have come out of the public health literature and the medical literature, especially with recommendations for reorganizing what would be a reopening of a community as we enter the next phase of this pandemic. In general, they all call for certain criteria to be met before we move into a reopening phase, and there are 4 main criteria. The first is that we want to see a reduction in the disease counts in the community for a period of time. The second is we want to scale an availability of rapid testing capacity. The third is we need to have a healthcare system that is staffed and resourced, complete with enough PPE to care for patients. And the fourth is a public health infrastructure to complete comprehensive contact tracings as part of a test and isolate approach. So what each of these publications are saying is that the cornerstone to a safe pandemic recovery is through assessing those 4 main criteria at the local level and determining an assessment of the local needs, as well as examining what infrastructure is in place for what expansion or scalability there are at the level of the community, not just at the level of the health system or the public health system. And what the literature calls for is a comprehensive and inclusive process at the community level. What happens there is essentially a risk assessment where we identify risks, we estimate the likelihood of those risks, and then we take an honest assessment of what the consequences of risks would be, as well as what mitigation strategies there would be. And the key point with all this is that there is no one pandemic recovery plan that works for every single community or every single entity. Instead, what the latest guidance from the literature is saying is that each community needs to look at its local needs, its local context, and what risks there are, and then take a principled approach to moving forward.